Welcome, everyone, to the Pain-Free Life Coaching Low Back Pain Masterclass. Really excited to put this on. Really excited that you guys are all here. So I guess we'll go ahead and jump right in. I guess if you have any questions, go ahead and put them in the chat box, and we'll go ahead and address those at the end during the Q&A section. So our objectives today are one, to discover the root cause of low back pain. It's going to be a little bit different with everyone as far as your specific root cause, but we're going to look at that, and we're going to discover why traditional approaches don't work, and empower yourself with the knowledge and skills to start healing your low back pain. So I guess we wanted to just do kind of a quick anatomy lesson here. So we're looking at the low back musculature. And so we're going to look at the thoracolumbar fascia. It's the deepest abdominal muscle that wraps around, as you can see, all the way around to the spine. So this starts here at the spine, wraps all the way around the front, and comes all the way back around to meet at the spine there. We've got the latissimus dorsi muscle, which actually attaches up into the upper arm bone and comes down and attaches into the thoracolumbar fascia down into mostly the lumbar vertebra. We've got the multifidus muscles, which are a lot of the low back stabilizer muscles. And then we've got the erector spinae muscles, which run up and down the spine all the way from the head all the way down to the pelvis here. So for those of you who don't know who I am, my name is Brian McKay. I'm a master trainer with Pain-Free Life Coaching. I suffered with chronic pain for 7 to 8 years. We'll go into that in just a minute. But so basically in 2011, I injured myself. I went and saw my physical therapist that I was working with for another injury. Again, we'll get into that in just a minute. And it put me on a journey of self-healing. And so I ended up finding a gentleman named Paul Chek on YouTube. So I actually ended up studying with the Chek Institute. I also studied under a level 3 Chek practitioner for 3 years. We'll go into a little bit of the Chek work a little bit later on. Studied with the Postural Restoration Institute, studied their philosophy, their ideas. I liked and agreed with some of their stuff, didn't like and didn't agree with some of the other stuff, but as they say, take what you need and leave the rest. And then so I finally discovered the secret to healing my pain from a physical therapist. And so I love to share my experience and knowledge to help reduce the suffering in the world because I've been there. And so I've suffered from a broken femur. That was my first broken bone in my teenage years. I broke my hand here. I don't know if you can see that, but I've got a boxer's fracture from an angry, ill-thrown punch at the wrong thing. I also shattered my kneecap in a car accident. I have suffered with chronic back pain, chronic neck pain, and chronic shoulder pain. So all of these things. And kind of speaking of which, this is a picture of my kneecap when I shattered my kneecap. That was just right after surgery. So you can still see all the swelling. If you look here in the middle, you can look at my cervical spine and just how straight that is. I've definitely had issues. You can kind of see here what that is. So when I was 12, I actually rode my bicycle off a bike jump far too slowly and went, heels over head and landed right on the back of my head, the back of my neck, and really messed myself up. And I think I'm still dealing with some of the ramifications of that today. But kids will be kids. You got to live, you got to learn. So, and then this last picture is actually an x-ray of my lumbar spine. This was from a few years ago. But as you can see, my L5-S1 disc is slightly bulging, and it is bulging in the opposite direction of how most people's. This one's actually bulging forward. And so that makes things a little bit more challenging to work with. And so we'll go into some of that later. But bottom line, I've been there. I've been where you are. I know what it's like to live with chronic pain. And I want to help you to be able to get out. So I guess we'll go ahead and dive into what exactly is pain. And I'm going to use a metaphor here. I'm not big on science speak, if you will, because not everybody speaks science. So what is pain? Basically, pain is our body trying to send us a message. So just like a text message or a check engine light on your car, you probably wouldn't ignore that. I guess, yeah, I have a lot of emails, but no text messages. So, this is a signal to us, letting us know that something is awry and we need to go ahead and address, whatever the issue is. And a lot of times, more times than not, the pain is just a symptom of something else. Very rarely is the root cause of the pain where the actual symptom is. So what causes spinal pain? So basically there's physical causes, there can be mental, emotional causes, and there also can be spiritual causes as well. So the physical causes of low back pain can include poor posture, improper lifting technique, overuse injuries, or traumatic injuries such as a fall or a car accident. The lower back is also really susceptible to strains and sprains, which can be caused by sudden movements, heavy lifting, or repetitive activities that put a strain on the lower back muscles and ligaments. So the discal causes of low back pain are a herniated or bulging disc in the spine that can cause low back pain. This can occur when the soft center of a spinal disc pushes through the tougher exterior, putting pressure on the nerves on the spine. So basically, as you saw over here, if it's bulging this way toward the nerves, it can put pressure on the nerves and really cause a lot of issues. So the muscular causes of low back pain, basically becoming strained or inflamed, causing low back pain. And this can be caused by overuse, underuse, or just generally poor posture. Now, the organ issues are an interesting one because organ problems such as kidney stones, bladder infections, ovarian cysts can cause low back pain. Even, stomach and digestive issues can also cause low back pain. And it can be dull, can be achy, sharp, stabbing, and it can be felt, right near the spine or more out to the sides, depending on what's going on. So coming back to the fascia causes of low back pain. So fascia is a thin layer of connective tissue that surrounds muscles, bones, organs. And when this tissue becomes tight or inflamed, it can really cause a lot of low back pain. And again, this can be caused by poor posture, overuse, underuse, or injury. So then looking at the mental emotional causes here, really emotional stress and anxiety can contribute to low back pain. When the body is under stress, it can cause muscle tension, spasms, which can really lead to pain and discomfort in the lower back. Emotional stress can also cause an individual to adopt poor posture, which can further exacerbate low back pain. I guess I will also mention that mentally, emotionally, low back pain is often caused by financial issues and particularly safety and security issues. And then last but not least, the spiritual causes. Looking at the spiritual or energetic imbalances can also contribute to low back pain. Some believe that emotional stress and trauma can manifest as physical pain, including in the lower back. So mind-body techniques such as meditation, yoga, can be used to address these underlying causes of the low back. So looking at traditional Western methods of treatment. So looking at over-the-counter medications such as Tylenol, Advil, Aleve, etc. Looking at prescription painkillers like muscle relaxers and opiates. Antidepressants, which I find that one very interesting, but apparently there's some science to back that up. Looking at physical therapy, cortisone injections, radio frequency ablation, implanted nerve stimulators, and spinal fusion or disc replacement. And so I want to go over kind of some of the negatives and the challenges of these, because they all definitely have their positives because they do reduce the symptom. I guess the physical therapy would look at actually addressing the actual cause. But the two main over-the-counter pain reliever options are acetaminophen, like Tylenol, and NSAIDs, which include like ibuprofen, like Motrin and Advil. You've got naproxen, like Aleve, and then also aspirin. And so the chronic NSAID use is put you at risk of bleeding in the stomach and also kidney damage. So a common cause of severe liver damage is often the chronic use of acetaminophen or Tylenol. So severe liver injury may occur if you take heavy doses, which is why they tend to, for fevers, recommend both, the acetaminophen and the Tylenol, and then the Advil or the ibuprofen, switching on and off, because that reduces the potential toxicity. So looking at the prescription painkillers, so opioids are often critical for post-surgical pain management because they work really well, but their side effects can be significant, including nausea, vomiting, constipation, urinary tract retention, drowsiness, impaired thinking, and even poor respiratory function, so ability to breathe. Also, overdosing and misuse of opioids are also very high risks, particularly when opioids are used to treat ongoing or chronic pain, rather than just, something kind of more of short term. Although the use of opioids after surgery is intended as a short-term strategy to relieve pain while the body heals, the risk of misuse is still a concern, even with the best of intentions. So then looking at the antidepressants for treatment, one of the antidepressants in particular is Cymbalta, and so it's FDA approved for low back pain and osteoarthritis, but just how antidepressants reduce pain is not well understood. And so one possibility is that they affect the chemicals in the brain involved in pain perception, a mechanism that differs from how they fight depression. So they may be helpful, but may just be kind of changing some brain chemistry, even, so that there's still an issue there. Same as kind of numbing out pain and issues with, the pharmaceuticals. So the risk of physical therapy include improper treatment. I had a personal training client back in the day that when he started with me, he told me a story of going to a physical therapist, and they were working on, shoulder stuff, and he was doing a traditional shoulder rotator cuff exercise, and not sure exactly what happened, but basically the tendon ripped from the bone, the muscle balled up in his shoulder, and he basically lost use of that muscle. They could have done surgery and repinned it back to the appropriate spot, but he chose not to. And so he is dealing with a shoulder that has a pretty significant shoulder stabilizer muscle that is no longer working for him. So also with the cortisone shots, there's a concern that it might damage the cartilage within a joint. Radiofrequency ablation is kind of one of the newest pain control techniques, where radio frequency waves are delivered to certain nerves with the goal of interrupting pain signals to the brain. So again, this is not an actual fix, it's just trying to numb the sensation. So we're not addressing the root cause. So the most common risk of any of the modern spine fusions is really just the failure to relieve low back pain symptoms following the surgery. Other complications include infection, bleeding, anesthetic complications. And then the last one is really, there's a lot of potential for complication of the surgery in the low back, including nerve damage. I've worked with several people over the years that have had, spinal surgery, and there's always a numbness that, people are wanting to get rid of. And unfortunately, because the skin and the nerves and the tissues are cut, oftentimes will always be there for life. So these are some of the, the challenges of, these traditional methods. I mean, we look over here at the failed back surgery syndrome statistics. 94% still suffer from low back pain. 71 still have a dull ache. That numbness is really big at that 70% of numbness. Some people have cold sensations, and then some end up, with paresthesia. So those are some of the kind of more Western methods. Now we also have the alternative medicine methods. So looking at massage, looking at yoga, chiropractic, acupuncture, acupressure, and then TENS unit, which is basically electrical stimulation of muscles and nerves. Now, all of these modalities really don't have any negative side effects. I will say, I have been injured by a chiropractor. I have also used chiropractors and continue to. So it all is very much individual dependent on their skill set and their philosophy. Yoga, I tend to run into a lot of issues with people practicing yoga for pain issues, and we're going to get into this a little deeper as we go on. But basically, yoga is a very stretchy and flexy modality of exercise. And so if your issues are stemming from instability, which would be kind of loosey-goosey, stretched everything, that's only going to exacerbate those issues. So while yoga can be a wonderful thing for somebody who is not in pain, unless you're working with a very skilled yogi who understands pain and pain science, it can actually move you in the wrong direction. Massage is another one. Massage is wonderful. It feels wonderful, done right and effectively by somebody skilled. It will loosen, parts of the body up, balance everything out, kind of the same as the chiropractic. However, a lot of massage therapists just are not fully understanding in how the body balances. And so you end up kind of over massaging, a particular point or the entire body, and you end up creating more of that instability. And again, if instability is your problem, that's going to create more pain. If instability is not your issue, it will at least bring you some temporary relief, but we've got to address figuring out how to balance the body back. Looking at acupuncture, that's really a modality that works on the meridian lines, which is based off traditional Chinese medicine, which is deeper than I fully understand, but I can give you just a rudimentary thing. Basically, there are points throughout the body that correlate with different organs and different systems. And so when you poke these needles in, it can trigger a response basically to tone down the rest, or the fight or flight part of the nervous system, upregulate the rest and digest and calm part of the nervous system, and really balance your energy systems. Acupressure is very similar, just rather than doing something that penetrates skin, you can actually use it with just pressure points. And then the last one is using the TENS units and using the electrical stimulation. It can be a wonderful thing. It definitely has helped me in the past. But I guess I will again share a personal story. I was working with a physical therapist. He had taken a week off for his honeymoon. He came back the following Monday, and he wasn't fully present with what he was doing. He was still on his honeymoon in his mind. And so unfortunately, he ended up cranking the machine, the electrical machine, and it was not this type. It wasn't a TENS unit. It was a much higher charge unit. And so he, not paying attention, cranked that sucker all the way up, lit me up. I was not right for hours after. So there is danger in some of those modalities as well. Moving ahead, looking to the temporary and partial fixes. And again, I don't want to talk badly about anything, because all of these modalities absolutely have their place. Like I mentioned, chiropractic, I utilize chiropractic. Acupuncture, that's actually one that I have never tried, though. If an issue is energetic, acupuncture can be a wonderful thing to help realign the energy systems. Looking at massage, again, if you have really tight muscles, it can be a wonderful thing to loosen things up and feel great, and can be part of the healing process. However, again, like I said, if everything is stemming from an instability issue and you're massaging and loosening things up more, you're only driving the dysfunction deeper into the system. Essential oils and aromatherapy, those absolutely have a place. However, rubbing essential oils on everything all the time is usually not the right, it's not usually a lack of smelling essential oils, is basically what I'm saying. That's may help with some symptom relief, and again, should be used in that way, but we absolutely need to be addressing the underlying cause. So looking at hypnosis can be a wonderful thing, looking at kind of shifting some of those unconscious patterns. Hypnosis really works really effectively if it's done every day for 21 to 30 days straight. The efficacy of a 1 or even a 2 time hypnosis really just isn't what we would like to see. So again, looking at the general yoga, again, can be great for the right person who's very tight and needs to loosen up. But a lot of times yogis are already hyper flexible and just, again, continue to drive that further into the system. Supplements and herbs can be a wonderful thing, again, depending on what's going on. Sure, you can grab herbs and supplements specifically for pain, or you can look at addressing the things that are underlying. So whether it be looking at, say, flower essences, if it's a mental emotional issue, looking at maybe digestive supplements, if some of it is inflammation related. So lots of different things. Meditation can be a wonderful thing, just becoming present with the pain and getting all right with it in the present. Although I will say, accepting pain in the present and accepting pain that this is going to be the rest of your life are two very different things. I would suggest that one is healthy and one not so much. And then the last one is traction. And so traction can be a wonderful thing. It is used frequently in chiropractic and physical therapy. And from my perspective, is absolutely a part of the healing process. The problem is, and we'll explain in a moment, is typically it's done passively. So you're having a machine or a person do the traction to you, rather than creating the traction yourself and making your muscles work and hold that that open space position. So again, we're going to come back to the spinal anatomy for just a minute. So looking at this diagram here, so these are the ideal curvatures of the spine. I've seen slightly different numbers here, but somewhere generally between 35 to 45 degrees in the low back. We're looking at about 30 to 35 degrees in the upper back, and again, about 30 to 40 degrees in the neck. And basically, a lot of times what happens is basically we end up in one or two postures where either these curvatures all over accentuate like this with big S curves, or what ends up happening is the spine kind of straightens out and everything ends up compressing. And that's what ended up happening here in this image over on the right here is this. You can see kind of the spine straightened out because it doesn't have this nice curvature. And so what ends up happening is the lower discs on the lower vertebra compensate, straighten out, and then start bulging the disc. So we've got a bulging disc here, got a bulging disc here, and then this one has fully herniated into and touching the spinal cord, which is where the massive amounts of pain come from. So speaking again of traction, traction is a wonderful modality. So here you can see you've got a physical therapist or a chiropractor using a traction table machine. You've got teeter hang-ups, inversion table. These can be a wonderful thing. But again, the problem with these is these are both passive. So as soon as you stand back up, all that compression ends right back on those lower lumbar discs. And really it feels good while you're doing it, but again, within a few minutes of standing, all of that compression happens again. And so one of the tricks that I have learned is actually what's called Eldoa exercises from a gentleman named Dr. Guy Voyer. He's a French osteopath. I forget what the Eldoa stands for. It is a French acronym, but translated, it basically means osteoarticular decoaptation stretching. So basically it means it is stretching the vertebra in between each other and creating space for the discs. And so I love this method. I think it's wonderful. However, by the sheer nature of a pulling apart, that also is going to create a straightening. And so just again, like I mentioned over here, where the spine can either overarch or straighten, typically with the Eldoa and the traction type methods, you are going to get more of that straightening effect. So then if you've ever been to physical therapy, I would be shocked if you had not come across the McKenzie method. And it's basically a philosophy of active patient involvement and education for back, neck, and extremity issues. And so it basically requires a patient to move through a series of activities and test movements to gauge the patient's pain response, and then to centralize the pain or move the pain from the leg or into the low back, or from the low back to hopefully get rid of it. And so what I have found is combining both the traction effect of creating the space for the disc, followed by some extension exercises, we really get a massive amount of relief for most people. So again, looking at the spinal anatomy, and again, how these all curves, and I guess I will mention the 3 planes of motion. So we have basically a front to back plane of motion, which you could see in the spine would be this way. We have a side plane of motion, which is kind of side bending like this. And then we also have a rotation back and forth like this. And what ends up happening is, because we're all human, actually, I'm just going to go ahead and change the slide here. Because we're all human, we all are asymmetrical. So if you're looking at the this little image over here, we've got the heart slightly on the left. We've got the lungs. One lung, the left lung has 2 lobes. The right lung has 3. We've got this big liver on the right. We've got these other smaller organs on the left. And so what ends up happening is the body actually ends up compensating for that. I personally have a belief that the forward head drives a lot of this issue, but you can see through this image here that what ends up happening is, due to these asymmetries, the body compensates, typically with the pelvis rotating and facing back. So your pelvis rotates to the right, and then what ends up happening in the upper body is the ribs basically rotate to the left, with the sternum still facing right. So it's basically a torquing back and forth of the body, and that's often why people will end up with a short right leg or a high right hip, is because they're just human, and their posture has basically caused a deepening of this pattern of this Postural Restoration Institute left AIC model. And so again, it definitely has a place, I think, that explains a lot. And then we can kind of look at, addressing the things and looking at root causes. So we've looked at, a few different things. So we've looked at the traction. We've looked at moving the spine back into proper alignment between that 30 to 45 degree curvatures, looking at this rotational pattern that happens. And then looking at, this is a slide, this is an interesting thing called anatomy trains. So this was a massage technique modality that a gentleman named Thomas Myers invented. I believe it is based off of another massage technique called Rolfing. I believe Thomas Myers just kind of took his Rolfing experience and made something out of it. But this is a really interesting one for a couple of reasons, and I guess I'll point to a couple of these. So looking at the fascial lines for the low back, so we've got this one here, which is called the superficial back line. So this actually starts underneath the foot, goes up the calves, goes up the hamstrings, through the butt, and then up the big muscles that go up and down the spine the whole way, all the way to the back of the head. And then the fascia actually ends up back over the head and ends up right in the front of the forehead, right about here. And so again, what ends up happening more often than not is this superficial back line gets stretched out. And so you can see, like, if I'm sitting forward and I'm hunched forward, all of these muscles throughout the whole back side of me get stretched. And so this is just one of the ways of looking at and working with the muscles and fascia, addressing specifically low back pain. But also, if you look over here, this is what's called the functional back line. And so this starts up in the shoulder with the latissimus dorsi that we mentioned in the beginning of this, again, tying into the thoracolumbar fascia and into the the lower vertebra, but it also ties into, so the functional line means basically it's a cross pattern. So it goes this right latissimus dorsi to the left glute max, and then down into the hamstrings hamstrings here, and then vice versa, the left latissimus dorsi with the right glute max, and then the right hamstring. And so again, these both tie into the low back pain. And so again, just giving more understanding of what's going on. So again, the philosophy here is really about addressing the root cause. And so again, we looked at the physical causes, the disc, the muscular problems, which is going to, be looking at the anatomy trains, and the frankly the eldoa, because you're actively stretching, using your muscles to create the space for the discs. Organ issues, which is really looking at nutrition and lifestyle factors, which I guess I will just mention. Every organ is so the nerves start in the brain, run down your spine, and come out through each vertebra spot. And so what ends up happening is one nerve will what's called innervate, which means it will feed both muscles and organs. So what that means is, if you are having an issue with an organ, your organs may not necessarily, some organs do, some organs don't, have nerve receptors to feel what's going on in the organ. An example of that is if somebody's having a stroke or a heart attack, you feel the left arm go numb, not so much the chest. And so again, that's the heart feeding the muscles there. So, and then like I mentioned, the fascial issues, looking at the anatomy trains model as well. And so looking at the, looking at getting to the root cause here, this is what's called the Czech totem pole. And Paul Czech created the Czech survival totem pole to create a system of getting to the root cause of pain and dysfunction. And so I'm going to go through this quickly. So at the top of this totem pole is the bird that is representative of the psyche. And so again, for survival, you need to want to live. If you don't want to live, you will not survive. Beyond the psyche, then we go into looking at the breath, and not only the ability to take a deep breath into the lungs and breathe that way, but also breathing at a cellular level, meaning cellular respiration, which is basically where we're using glucose, which is sugar, oxygen combined, and that is what gives every cell on planet Earth its energy. And so if we don't have breath, again, looking back at that survival thing, minute and a half, 3, 4, 5 minutes, you're cooked, you're toast. So breathing is, again, the second most important thing besides the psyche and wanting to live. Moving down further, looking at the jaw and the ability to chew. Now, we have technology like blenders nowadays, but back in the day before modern technology, we had to chew all of our food whole. And if we ground our teeth out, whether it be due to, bad hygiene or just, maybe some TMJ issues where you're grinding and chewing on one side and causing issues, if you grind your teeth out, you are not going to make it long, 7, 14, 30, 40 days. And that's about all you've got once you lose your ability to chew and digest, masticate food. So again, looking at everything from a short-term to long-term survival perspective. So then looking at the ability to see and the ability to hear. And so most of that is the ability to see and hear predators, but also the ability to see and hear prey to be able to find food and continue to survive. And the reason why this is so important, and I'll use myself as an example, is my right eye is stronger than my left. Also, my right ear is also stronger than the left. So what that ends up doing is I end up turning my good side to hear and to see to do that, which is wonderful until we get down to this next spot, which is the position of the atlas or the C1 vertebra, and that rotates. And so when I turn my head, that now puts the position of the atlas in a not normal alignment position, and that can be problematic. And the reason that that's problematic is the atlas, or the C1 vertebra, is the only vertebra that that every nerve in your entire body runs through. So if that one gets rotated, pinched, in whatever axis it may be, it is going to pinch off nerves. Which nerves, we don't know. To what extent, we don't know. However, looking at that as, again, a survival issue is going to affect everything further down the chain. So again, if that atlas is out of position, it's going to affect the organs more than likely. Again, if anything's, pinched off, it's either going to affect muscles or organs or both. David, thank you for joining us. And so, so the function of the organs is very important. If our liver starts shutting down, again, a little longer term than the ability to breathe or eat, but we're going to end up dying anyway. So looking at the limbic system is another name for the limbic system is the emotional system. And though it is on a similar pathway as the mind and the mental system, it is a bit different. And it's the only one that actually can move up and down this totem pole, similar to the psyche. Because again, if you are, suicidal, having that difficult of a time in life, you can end your life there. So now that we've addressed all these, we come down to the sacrum and the coccyx and the pelvis, which is what the low back sits on. So again, all of these things above are going to correlate with, again, digestive system is going to relate with the low back. The pelvis and the sacrum and the coccyx is going to affect the low back. And then even beyond that, and again, your nerves finish in the very end of the tailbone. So you've got the nerves that start in the brain, run all the way down, all the way to the end of the tailbone. And if anything's pinched off there, again, that can cause issues. Again, going back to that PRI and that rotational profile of the sacrum and the coccyx, that is going to affect the slave joint. So the ankles, the knees, the hips, the low back, the shoulders, all of these aspects are going to be affected from everything up the system and up the chain. And so again, we always want to look at the highest thing. We want to address the symptom that you're suffering from, but we want to address the underlying cause. Otherwise we're just, again, throwing a band-aid on the issue. So with that being said, the plan. So my plan, if you are interested in working with me, is one, we determine the root cause of your pain so that you don't have to put band-aids on the problem anymore. So we're going to look at you physically. We're going to send over a health assessment questionnaire, look at some of those organ issues and some of these other higher functioning issues that we saw on the totem pole. And really, again, stop working with the band-aids. Sometimes band-aids are necessary. I spoke to a woman recently. She's a tax accountant. It's a couple weeks away from tax day. So she's not able to address these issues right now. And so she's able to kind of throw some band-aids on her symptoms and address things once, she has the time and the ability to address that. So second, we address the symptoms so that you get out of pain, and the root cause so that it doesn't come back. And then we teach, the third, we teach you how to strengthen your body so that your pain doesn't come back and you can do the things in life that you want. Whether that be playing with the grandkids, going golfing, whatever it is that you want to do, my goal is to help you achieve that. And so again, looking at the pain-free life coaching method, we create space through foam rolling and specific stretching techniques so that we can create the space for the disc to reside so that it's no longer being smushed. Then we look at balancing the lumbar lordosis, whether it be kind of an over curvature or an under curvature and straightening through corrective exercise and more stretching. And so that then puts the discs in better alignment. And so if you can imagine for just a minute, we'll just say this is totally straight. And you can imagine that, like, if it's straight, when the muscles that attach to either side of the spine tighten, it is going to compress on those discs. And so what ends up happening is when we start to reshape that spine back into its proper, 30 to 45 degree curve, rather than when they tighten, rather than compressing, it's just going to open that space up, for the disc in that proper alignment. So then once we've got the lumbar spine adjusted or balanced, I guess I would say, then we start with the low back because the vertebrae are the largest. There's a lot of large muscles there. And so it's the easiest to work with to get some stability through the entire chain. So then looking at balancing the back, the upper back and the neck through, again, the corrective exercise and stretching, again, creating more of that space through the neck is important, but then reinstilling that cervical curve again, so that, again, when the muscles tighten, they don't compress and smush the discs. So then looking at addressing the root causes and underlying factors through holistic lifestyle coaching and nutrition coaching. And then once you're out of pain, we focus on getting you strong so that you can use your body again for the things that you want to do. So I guess I'd be curious if there's anybody would like to share, what is it that you would like to be able to do with your body in this life? Just go ahead and put it in the chat. All right, so we got somebody that wants to play with their grandkids, just wants to be able to go for walks. Beautiful. So I guess that has been the presentation. So I guess I'm going to open the floor. I will go ahead and if you'd like, go ahead, raise your hand, unmute yourself, and I'd be happy to take any questions that you may have. Hey, David, you got any questions? You came in a little late.
Yeah, I'm sorry about that.
That's no problem at all.
I guess the question that I would have for you is, does anything of this apply to somebody who is already mostly fused?
Surgically or okay. So
I've got 3 lumbar levels fused and I've got 5 cervical.
Okay. Yep. That definitely becomes much more difficult. What I typically tell people that have already had those types of fusions is there's some improvement that you can get. As far as alleviating it completely, it's usually pretty limited, just because you have been cut open. So, I mean, even just a single incision across the spine, you're cutting skin, you're cutting fascia, you're cutting nerves. And so there just kind of always ends up being that kind of numb pain. Is that true for you?
Well, I've had radicular pain. I've had, more central pain, but I guess I could go on and on. I'm basically dealing with failed back syndrome.
Okay.
You're familiar with that, I would hope.
Yeah,
right?
we did cover that actually.
Okay. Yeah, I'm sorry. I kind of.
That's no problem at all.
I got bogged down. I was really looking forward to this, and then I missed it. But my biggest problem immediately right now is the fact that my cervical vertebrae, because of the 2 separate procedures, 2 levels each time, is badly out of alignment now.
Okay.
Everything is too far forward, and so the base of the neck is having to try to hold this all up. Mm-hmm. And just a couple weeks ago, I actually ended up having an epidural, and they had to go in down at T1-2 and feed a catheter up because they couldn't get in there because of the fusions. Okay. It is somewhat better, but I've been having back pain since June of 1981, and I've not ever been free of it since then. And I guess I'm just, looking for anything. It forced me into an early retirement. It's just I'm getting to that point of desperation because I don't know what else to do, nor does anybody else.
Yeah, absolutely. Yeah, like I said, there's definitely improvement that's possible. Complete relief, honestly, after that kind of surgery is um, not too terribly likely. However, again, getting you back to a manageable level is definitely a possibility. So I guess when we get done here, I will. Technology is my nemesis.
Yeah, well, don't let me monopolize things here. I don't deserve it since I missed most of
No,
everything.
you're
So,
fine. But yeah, one definitely be able to send you over the recording, and two, if you'd like to schedule a complimentary consultation, we can dive a little deeper and see, you know, if I'm not able to help you.
okay.
Cool.
Yeah, I don't know. Like I said, it's just kind of a desperation kind of thing. I'd like to try to enjoy what retirement I have, but since this forced me into the retirement, I don't have a whole lot of choice in things, I guess.
Yeah. Well, there's
Okay.
always improvement, to be made, and some semblance of quality of life is definitely attainable.
Well, that's the big issue at this point right now is the quality ain't good.
All right, beautiful.
Yeah.
Well,
Okay.
yeah, we'll chat after the presentation. So
Okay.
appreciate it. So, all right. I didn't see any more questions come through. So I'd like to thank everybody for being on the call tonight. I hope this was useful to you. And if you would like to schedule a complimentary consultation to see what this might look like for you and how we can work on reducing your pain in your life, go ahead and schedule a complimentary consultation. We'll go ahead and throw that link in the chat box here in just a moment. So thank you everyone so much for being here and spending your evening with me. And I hope this was valuable. So thank you all so much, and we'll talk to you soon.